Hello, everyone. It's Dr. Cary Yurkiw, and welcome to today's webinar on knee pain. Been looking forward to doing this webinar because knee pain was the main reason I went to see a chiropractor when I was a teenager. I had a lot of knee problems, and I had gone to see our family doctor, and then my father found a chiropractor in our area and took me to the chiropractor who examined my knees, did x-rays, diagnosed my knee problem, and then did treatment to help me. So this is one of the main reasons why I became a chiropractor, and I'm excited to share with you today how chiropractors can help with knee pain. So I've been in practice for 26 years. I saw a chiropractor when I was young, and I started practicing in Winnipeg, where I was from, and then we moved to Penticton, Summerland actually, and I opened a clinic in Penticton in 2008. Recently, our family moved to Kelowna, so I've started a new practice in Kelowna, and we have flexible hours. We're open until 7 p.m. and on the weekends. So knee pain, what causes knee pain? What can we do to help? And I want you to understand the anatomy and the physiology of the knee as well. So where does knee pain come from? Well, an injury to the joint can cause knee pain. Sometimes athletes injure their knees. The knee is an exposed area. It's susceptible to injury. Let's say in a sport like football or soccer or hockey, any type of those running type of sports or active sports. And if there's a collision or if somebody steps on your foot or if they collide with you from the side, it can really injure the knee. And we'll go over that today. Poor alignment with the knee or even the joints above and below, like the hip and the ankle, can cause the knee to be off balance, and it can wear out one side faster than the other. So wear and tear can happen in the knee, and if it does, then arthritis can develop. So you can get degeneration or arthritis from wear and tear to the knee. And then inflammation can happen, and inflammation is there to repair the knee and help facilitate the healing process. But if inflammation is present all the time, then that's not good for the knee. It can cause the knee to break down, the joint to become toxic, and then the cartilage and the tissues to start to break down. So chronic inflammation is not good. Let's go over the anatomy and the physiology of the knee. There's 4 bones in the knee area. There's the femur, there's the tibia, there's a small bone on the side, the fibula, and then there's the patella, the kneecap. So there's really 4 bones. Most people think about 2, maybe the femur and the tibia, the shin bone, but don't think about the fibula, the smaller bone on the side, so much that goes all the way from the knee down to the ankle, and the patella, the kneecap, it's gliding through a groove in the knee. There's cartilage at the end of the bone, so cartilage coats the end of the bones and protects the bone. There's fluid in the joint called synovial fluid that helps to lubricate the joint and provide circulation in the joint. There's muscles around the knee. The quadricep muscle is a large muscle from the thigh that runs through the kneecap and down into the tibial tuberosity, right on the underneath the kneecap. And there's tendons, like the patellar tendon and other tendons running, the hamstring tendons running across the joint. There's ligaments inside the knee. The 4 most common ones are the ones on the sides, the collateral ligaments, and then there's the 2 that cross in the middle of the knee called the cruciate ligaments. So the cruciate and the collateral ligaments are often ligaments that are injured if the knee has some kind of trauma. And then there's bursa, and the bursa are sacs of fluid that protect the bones from the muscles and tendons rubbing on them. So the bursa provides kind of a cushion for the muscles and the bones so the friction doesn't develop and cause inflammation. So what are some common conditions in the knee? Well, one that comes to mind is runner's knee or iliotibial band syndrome. That's something that I think about because I'm a runner. So iliotibial band syndrome is a condition where um, the knee on the outside starts to get irritated from the band that comes down the side of the leg, crosses the knee joint and inserts just across the joint. So iliotibial band syndrome is common, and that's an irritation, inflammation of the tendon and the muscle crossing the knee joint. For iliotibial band syndrome, I find a lot of patients have poor balance or poor symmetry in their hips, so they have imbalances where the muscle originates up in the iliac crest area, and that can cause tight muscles, and then that can affect the way that that muscle and tendon function. But also poor function or alignment of the knee and the ankle, that can affect the knee as well, and then cause that muscle and tendon not to work properly in the knee joint. Arthritis is a common condition, and that's where the cartilage starts to break down, the bones start to wear out, and then we get some spurs forming, kind of like calcifications and bone material spreading out and kind of starting to bridge the knee to try to support it. So we do see arthritis often in the knee joint, more commonly osteoarthritis, but sometimes people have another condition called rheumatoid arthritis as well. We see patella femoral syndrome. Patella femoral is the patella, the way it's gliding through the groove in the knee joint. So as you bend your knee, the patella protects the knee joint, but it glides through a groove. Sometimes the way it glides through the groove, it's off to one side, and it can cause some friction, and actually sometimes it causes a sound like a clicking sound or a cracking sound as it glides through the knee joint. So patella femoral syndrome is something that we see, and we work with patients on to balance the muscle groups to get the groups stronger so that the kneecap glides through the knee properly. But we also do a treatment and provide symptom relief for the knee as well. And then there's ligaments and tendons. So in the knee joint, there's the cruciate ligaments that we talked about, the anterior cruciate ligament, the posterior cruciate ligament. These are common injured ligaments, more so the anterior cruciate ligament. And then we've got the collateral ligaments on the side. Those ligaments will sometimes get injured if there's trauma or pressure on the side of the knee, kind of like an out to in pressure, in to out, laterally or sideways on the knee. And then there's bursa. So we talked about the different sacs of fluid. There's the suprapatellar bursa, the prepatellar bursa, the infrapatellar bursa. When I was younger, I shared that with you earlier, the infrapatellar bursa and the patellar tendon were inflamed, causing a lot of pain for me. So an inflamed bursa can swell, and it can get quite hot and tender. So that bursitis can be a common condition we see in the clinic too. So what can be done to help? Well, as a chiropractor, we want to check the knee, see what kind of alignment and shape it's in, do a full assessment of the body and make sure we understand what's causing the symptoms. And then we want to do adjustments. So we adjust the knee either by hand or using instrument to improve the alignment and the function of the knee. We do prescribe hot and cold depending on the condition. Some conditions, cold's better, like if there's just been a trauma to the knee, applying cold can be better. But if there's chronic, long-standing arthritis in the knee and it's very stiff, heat can be better. I've used shockwave on the knee. That's a therapy that helps to reduce adhesions and inflammation in the knee area. So it just helps to get rid of some tight tissue in the knee area. We've prescribed stretches. As the patient progresses, we've given them stretches to do at home to help their knee and to maintain the changes we've made in the clinic. We've given braces to support the knee, to give it extra stability and strength while it's healing. Ultimately, long-term, our goal is to not have to wear a brace, but some people, depending on the knee condition, may have to wear a brace, especially if they're doing certain types of activities like sports. We've prescribed orthotics if there's poor mechanics of the way the person walks. So if their gait or the way they walk is poor, it can cause twisting or stress on the shin bone and right up into the knee. So orthotics can help to rebalance and correct some gait abnormalities or the way you walk. And then of course, follow-up. Follow-up with patients in the clinic, follow-up using telehealth now can really be beneficial to guide patients and maintain the changes we make in the clinic to reduce and eliminate the pain and to restore the function. Other things we do in the clinic are we look at the posture of the person. Is their alignment good from top to bottom, or are they crooked, like the picture on the left here? If there's misalignment, it can cause more pressure on one side than the other. So for this lady, there's going to be more weight on the right knee than the left knee. We do talk about nutrition, things you can do to help heal the knee. So things like protein, drinking enough water, electrolytes, just eating the best foods to keep a normal weight and a weight distribution in the body is important. Talk about stress, because stress can be pro-inflammatory and we don't want to see our patients stuck in a cycle of continuing stress and inflammation. Shoes are important, so we do talk about the type of footwear that our patients have. And then of course, exercises. What exercises to do for the knee. Sometimes with a knee condition, I'll recommend non-weight bearing exercises. So these exercises can include swimming or walking or cycling. I like the ones that are a little bit lighter on the knee, like cycling and swimming, because it allows the knee to start healing, and then there's not a lot of extra weight or stress on the knee. So it just allows the range of motion to improve, the circulation in the knee to improve, and then that allows the knee to start to heal better without the weight and the stress on the knee. If you have knee pain, you can call our office to book an appointment. It's 250-486-0062. We're in the Kelowna area, so we are taking new patients, and feel free to call our office. We're located at 105-1628 Dixon Avenue. That's the landmark towers, which are close to Harvey. Got the white bridge going over Harvey. We're on the right-hand side, those glass buildings. If you're interested, I wrote a couple books last year that are on Amazon, one on back pain and one on neck pain. Those books, you can go to Amazon, type in back pain and then my name, and the book will come up. It's in Kindle, paperback, and Audible format, and you can read that book and understand a little bit more about how we treat people in the clinic, how we deal with chronic issues like chronic back pain and arthritis. If you're interested in our upcoming webinars, make sure you go on our Eventbrite page, Yurkiw Chiropractic, and you're going to see the webinars listed here. The upcoming webinars are shoulder pain coming up on Monday, August the 17th. We've got advanced stretches on Thursday, August 20th. We have lifestyle changes for back pain on Saturday, August 22nd, and mid, back, and rib pain on Sunday, August 23rd. So certainly sign up or tell your friends about our events. This is our page address at the top. And certainly, they can sign up. Space is limited. We have enough for about 20 spots, but certainly spread the word and sign up for our webinars. Well, I want to thank you for joining us today. I really enjoyed talking to you about knee pain. If you have knee pain or you know somebody who does, certainly call our office and book an appointment. You can send an email to us if you wish, if you have any questions. I hope you can join us for a future webinar, one of the upcoming webinars in our series. So have a wonderful day, and I look forward to seeing you next time.